Hello, everyone. Welcome to episode 4 of the California CNA Test Preparation podcast. Are you ready to begin? Okay, let's go. Long-Term Care Medical Systems Study Guide for CNA Exam. 1. Nervous System. What it is, the body's control center that sends messages throughout the body. Main function, controls all body activities, including movement, thinking, and feeling. Key parts. Brain controls thinking, memory, and body functions. Spinal cord carries messages between brain and body. Nerves carry signals to and from different body parts. Important for CNAs. Watch for changes in mental status, confusion, alertness. Report seizures, dizziness, or weakness immediately. Help protect patients who have nerve damage or paralysis. 2. Immune System. What it is, the body's defense system that fights disease and infection. Main function, protects the body from germs, viruses, and harmful substances. Key parts. White blood cells fight infections. Lymph nodes filter harmful substances. Spleen removes old blood cells and fights infection. Bone marrow makes new blood cells. Important for CNAs. Use proper infection control, hand washing, gloves. Watch for signs of infection, fever, redness, swelling. Some patients have weak immune systems and get sick easily. 3. Cardiovascular System. What it is, the system that pumps blood throughout the body. Main function, delivers oxygen and nutrients to all body parts and removes waste. Key parts. Heart pumps blood through the body. Blood vessels. Arteries carry blood away from the heart. Veins carry blood back to the heart. Capillaries, tiny vessels that connect arteries and veins. Blood carries oxygen, nutrients, and waste. Important for CNAs. Take vital signs, blood pressure, pulse. Watch for chest pain, shortness of breath, swelling in legs. Help patients with heart conditions avoid overexertion. 4. Integumentary System. What it is, the skin and everything attached to it. Main function, protects the body from injury, infection, and temperature changes. Key parts. Skin, the body's largest organ. Hair helps regulate body temperature. Nails protect fingers and toes. Sweat glands help cool the body. Oil glands keep skin moist. Important for CNAs. Check skin daily for pressure sores, bed sores. Keep skin clean and dry. Report any cuts, bruises, rashes, or skin changes. Help prevent skin breakdown by turning bedridden patients. 5. Gastrointestinal System, Digestive System. What it is, the system that breaks down food and absorbs nutrients. Main function: digests food, absorbs nutrients, and removes solid waste from the body. Key parts: mouth, where digestion begins. Esophagus tube that carries food to the stomach. Stomach breaks down food with acid. Small intestine absorbs most nutrients. Large intestine absorbs water and forms stool. Liver makes bile to help digest fats. Pancreas makes enzymes to help digestion. Important for CNAs. Monitor bowel movements, frequency, consistency, color. Help with feeding and nutrition. Watch for nausea, vomiting, abdominal pain. Report changes in appetite or eating habits. 6. Respiratory System. What it is, the system that helps us breathe and get oxygen. Main function: brings oxygen into the body and removes carbon dioxide waste gas. Key parts: nose and mouth, where air enters the body. Trachea, windpipe, carries air to the lungs. Bronchi, tubes that branch into the lungs. Lungs, where oxygen and carbon dioxide are exchanged. Diaphragm, muscle that helps with breathing. Important for CNAs. Count respirations, breathing rate. Watch for difficulty breathing, coughing, or chest pain. Help patients with breathing exercises. Keep airways clear, help with coughing positioning. 7. Musculoskeletal System. What it is, the bones, muscles, and joints that give the body structure and allow movement. Main function: supports the body, allows movement, and protects internal organs. Key parts: bones give structure and protect organs. Muscles allow movement and maintain posture. Joints, where bones meet and allow movement. Tendons connect muscles to bones. Ligaments connect bones to other bones. Cartilage cushions joints. Important for CNAs. Help with safe movement and transfers. Watch for signs of fractures, broken bones. Report joint pain, swelling, or limited movement. Help with range of motion exercises. 8. Urinary System. What it is, the system that removes liquid waste from the body and maintains water balance. Main function: filters blood, removes waste, and maintains proper fluid balance. Key parts: kidneys filter waste from blood and make urine. Ureters, tubes that carry urine to the bladder. Bladder stores urine until it's ready to leave the body. Urethra, tube that carries urine out of the body. Important for CNAs. Monitor urine output, amount, color, odor. Help with toileting and incontinence care. Report burning, pain, or difficulty urinating. Keep accurate intake and output records. 9. Reproductive System. What it is, the system responsible for producing offspring. Main function, produces sex hormones and allows for reproduction. Key parts: male penis, testes, prostate gland. Female ovaries, uterus, fallopian tubes, vagina. Important for CNAs. Provide respectful, private care for reproductive organs. Report unusual discharge, bleeding, or pain. Understand that reproductive health affects overall well-being. Maintain patient dignity during personal care. 10. Endocrine System. What it is, the system of glands that produce hormones, chemical messengers. Main function, regulates body functions through hormones that control growth, metabolism, and reproduction. Key parts: thyroid gland controls metabolism, how fast the body works. Pancreas produces insulin to control blood sugar. Adrenal glands produce stress hormones. Pituitary gland, master gland that controls other glands. Important for CNAs. Monitor blood sugar levels in diabetic patients. Watch for signs of hormone imbalances, extreme tiredness, mood changes. Help patients take medications on time, especially insulin. Report sudden weight changes or unusual symptoms. Key terms to remember: vital signs, temperature, pulse, respiration, blood pressure. Symptoms, what the patient feels, pain, nausea. Signs, what you can see or measure, fever, swelling. Acute, sudden or short-term. Chronic, long-term or ongoing. Inflammation, redness, swelling, heat, pain. Study tips: 1. Practice pronunciation of medical terms. 2. Connect systems, understand how they work together. 3. Focus on CNA responsibilities, what you observe and report. 4. Use flashcards for key terms and functions. 5. Practice scenarios. What would you do if you notice certain symptoms? 6. Use our long-term care for patients or residents interactive learning tool linked in the comments section for vocabulary study of 290 vocabulary terms. Remember, as a CNA, you observe and report. You don't diagnose or treat medical conditions. Thank you for listening and studying with our podcast episode. Stay tuned for more episodes coming soon your way.